Well, the Congress and the Biden-Harris administration have really been focused on supporting communities. And so there's been this outpouring of federal support, federal dollars that have flowed to the states. And so my question and I'll start with Stephanie, how have the increased federal investments been in response to that have been provided in response to the pandemic really impacted your programs?
Thank you, Edwin. Just like Sandra mentioned, uh, having the appropriate gear in place, the equipment in place to protect our residents and to protect ourselves and our community. So we were able to purchase a good supply of PPE, face masks, face shields. We, uh, took a look at what we would need to have in order to re-enter facilities and to travel. So we did, we purchased booties, we purchased, thermometers for our staff, and then hand sanitizers. We really stocked up on our PPE. And it's been great because we have actually purchased safety kits for our team and for our volunteer ombudsman as well, so that they can stay safe when they return to facility visits. And they have, as of May 1st, our volunteer ombudsman. And one of the things that they shared with us is that, they really appreciated the fact that, we provided them with safety kits and they are feeling very safe with entering facilities. We also purchased laptops and iPads and cell phones for our team so that they can work remotely from home. Um, we hired a temporary full-time specialist. One of the things that we struggle with is that we have not been in facilities for over a year. And so in what ways can we increase our facility visits this year and try to play catch up? So that uh, part, full-time temporary staff person that we hired will help us with doing facility visits. As you mentioned, Alaska is huge, it's vast. And so we are centralized in the Anchorage area, and our team travels to, the different regions across the state of Alaska. So we've been able to increase our travel budget as well to be able to make those more visits to remote and rural communities. So yes, we are very appreciative of the additional funding, and we hope to continue on with increasing our facility visits for the next couple of years. And so putting a plug in for additional funding for long-term care ombudsman as well. It has really served its purpose, and we have, since March 1st, we have been able to visit over 100 facilities in different regions across the state of Alaska. So we're very appreciative of that extra funding.
Well, great. Well, I would mention in response to your request that I hope you saw that the president's budget showed an increase, reflected an increase for the long-term care ombudsman program. And it's in direct response to the request we've heard for a number of years from the National Association of State Ombudsman Programs and the long-term care ombudsman community, that there needs to be additional resources in order to
Absolutely.
ensure that they can get to all of the facilities in an adequate way. So I want to turn to Sandra for a second, because you had previously mentioned the need for training, the ability to provide training and PPE. Are there other things that you were able to provide with the federal investments, this influx of money that has come in response to COVID?
Yeah, one of the things we had to struggle with is how do we use this funding? We could use it to strengthen APS, but our community was in need of services. They were in need of PPEs. we found ourselves in the beginning with COVID on not just residents losing their care providers to provide for them, but no way to get out and get food for themselves. They couldn't go to the store and stock their home with toilet paper. The CDC was giving us guidelines on how to stay safe, but when you're low income and you can't get out and you rely on these caregivers, there's no way you can access those things you need to remain safe. So we came up with a list of things for our community that we thought would be helpful to serve the residents that we serve. We looked at training material, not just in English, but in other languages for the state of Alaska, written so that individuals could have that ability to read the things that the CDC says is important to do. We looked at PPEs for the individuals that are in their homes, those that wanted to go out into the community. We had a lot of adults with mental illness not wearing masks. So being able to provide a kit for the shelters that they could give out to the residents. Those are just a few of the things. The other thing we looked at is we have individuals that due to COVID lose a provider and they need to go in some kind of assisted living home, but they don't have the funding to do that. So we looked at that being a part of using that funding for them as well. And for our staff, the state of Alaska does a really good job, and I'll just put this plug in for them, is caring for their staff. So there wasn't much we needed. They provided the PPEs for us to go out in the community, but I thought my staff could probably benefit from winter gear and summer gear that they could, wouldn't have to take back to their homes, their own clothing they would wear out and do these visits with, and then they'd have to take their clothing back to their house, and their shoes are blending with their children's shoes. They're in the same car with their clothing on. So we thought about jackets and covers that they could use, much like a uniform, so that they could be protected and their family could be protected. So those are the things we looked at doing. And then the last thing I think which was important, well, two of the last things. One was combining our fundings with long-term care ombudsman's office so that we could provide more training to this community. But the final thing was that we were going to look at using some of the funding to get a short-term non-perm position here for Adult Protective Services, so that we could make calls to the adults that we have reports on and talk to them about the pandemic, talk to them about isolation and some of the things they could do, talk to them about if they wanted to be tested or not and where they could go, or what's a barrier to testing. And so those are the things we're going to be using this funding on. And we're excited that we get to use these resources for our community because we are a community, a small community. We are a large state, but with not a lot of community resources.
Right.
And so it makes a difference.